when a client comes in to see us, we want to hear all about the problem, right? This part is known as the clinical history. But the things that we look out for in the history are, number one, where does it hurt? Good place to start, right? People with Achilles pain, though, it will, strangely enough, they'll often point to their Achilles. But there are actually two different types of Achilles tendinopathy, so it is important to be very, very accurate with where they're pointing to. First of all, we've got an insertional tendinopathy. Now, the insertion counts for where it attaches into the heel and the next 2 centimetres of the tendon. And then we have a mid-portion tendinopathy, which is from 2 centimetres of the tendon all the way to 7 centimetres. But it's important to know which one we're dealing with because they are actually treated slightly differently when we get to the treatment phase. Now, secondly, have you or has the person you know gone through a relatively sharp increase in training load? Now, that could be an increase in the amount of times you train, otherwise known as the frequency. It could be an increase in the length of time that you train for, or duration of training, or it could be how hard the training is, or how difficult the session was. And that would be what we call intensity of training. Now, if you increase all of these quite sharply, or maybe even just 1 or 2 of these, then you are increasing the risk of overloading your Achilles tendon and causing a tendinopathy. So you need to be careful for that. And thirdly, we're looking for history of rheumatoid disease or a hypercholesterolemia. Yeah, good Scrabble score, right? Now, rheumatic disease is associated with Achilles pain because it causes something called an enthesitis, which is basically inflammation of where the tendon attaches into the heel. Another one of my wonderful descriptions there. I'm going to put a picture over that so you probably won't see it. And hypercholesterolemia can cause what's called xanthomas, which are little cholesterol deposits, which can also go on to cause some kind of Achilles pain. Now, if we find that there's a positive family history of either of these 2 conditions, they have Achilles pain, but there's been no obvious change in their exercise or loading, then it might be beneficial to get this person sent off for blood tests in order to rule out one or both of those conditions. Now, there's obviously a lot of other things that we'd ask during the clinical history, but when we're looking purely at Achilles tendinopathy, they are the 3 most important things that I personally like to check and find most useful. And we'll see you in the next video where we'll talk all about the clinical examination process. See you then.